Welcome to Hey Hailey's Boutique, where the style is so hot, it might give you blisters. Today, we'll be covering the inherited disease Hailey Hailey, aka benign familial pemphigus, as shown by the sign for the boutique that reads Hey Hailey's Boutique. Like the name benign familial pemphigus implies, the disorder is inherited, and in this case, in an autosomal dominant fashion. Oh, speaking of dominant fashion, take a look at that mannequin in the center. Notice how the mannequin's stand is decorated with autosomal dominant dominoes to remind you of the inheritance pattern. Notably, Hailey Hailey is one of the disorders due to a calcium ATPase, just like Darier's disease, and because the names can be confusing, boards often like to test them. In this case, the specific calcium ATPase transporter is ATP2C1. One way to remember this is with the mnemonic, "I want to see Halley's Comet one day." So, notice how our store's sign has a comet on it. However, to be consistent with our previous sketch covering Darier's disease, we'll give our mannequin a stylish 2-swan purse and 1 sword. And note how the stand that's holding her up is shaped like the letter C for ATP2C1. Clinically, these patients can manifest with clinical findings at almost any age, but it's generally in the teens and 20s, which is of course precisely the age group that I imagine would be shopping here at Hey Hailey's. Contrast this with Darier's disease, which almost always manifests prior to age 20. While the manifestations of Hailey Hailey's arise in a similar distribution to Darier's, it tends to be more localized to the intertriginous regions in Hailey Hailey rather than the more widespread seborrheic distribution of Darier's. To remind you of this intertriginous distribution, we've placed some ruffles on the mannequin's shirt around the axillae, lateral neck, intermammary fold, and waistline. While histologically this disorder is classified as a blistering disease, the lesions generally only appear vesicular or bullous in the very early stages, and by the time you see them in the clinic, the patient will simply have macerated or eroded plaques. So, to remind you that it's a blistering disorder, recall the brand new second mannequin on the ground who's still wrapped in bubble wrap. I chose bubble wrap because it seemed more plaque-like, and I want you to remember that the classic Kodachrome of Hailey Hailey generally won't show you discrete vesicles. That is, unless the patient happens to be experiencing a feared complication of Hailey Hailey, and one that it shares with Darier's disease, Kaposi's varicelliform eruption. This is essentially when the involved skin of a patient with benign familial pemphigus gets secondarily infected with HSV. To remind you of herpes, we'll add a stylish Hermes headdress into this mannequin. Now, for the path section of boards, acantholytic disorders are extremely high yield, and you should definitely spend some time learning how to differentiate between Hailey Hailey, Darier's, pemphigus, and Grover's, and the only way to master this is by studying slides. However, if you shift your focus to the back wall, we'll do our best to highlight a few key features that might help. First, notice how the bricks in this wall are falling apart. You might even say dilapidated. That's because falling bricks or blocks is our recurring hook for acantholysis, and in the case of Hailey Hailey, the acantholysis is often full thickness, hence why the bricks are falling apart from top to bottom. However, unlike Darier's, there is generally far less dyskeratosis, meaning you won't expect to find abundant core ronds or core grains, so note that there is no whole grain cereal or round object. Another useful feature is the lack of follicular involvement. You can remember this by recalling that Hailey hates hair. Or you can remember this disturbing giant mannequin head with "no hair, no care" written around the base. Yikes. Talk about something you would not want to run into in a dark warehouse. From low power, the epidermis of Hailey Hailey will show a psoriasiform hyperplasia, which is useful in differentiating it from pemphigus. So, let's spruce up the place a bit by decorating with a psoriasis palm tree here by the crumbling bricks. When it comes to treatment, probably the best treatment is surgical intervention with CO2 laser ablation. Fortunately for you, a new laser tag arena called Cool Tag just opened up and Hailey Hailey is advertising for them. Remember, Cool Tag is C and 2 O's, and it's laser tag for CO2 laser. Note that unlike in Darier's, retinoids generally are not effective. More recently, and perhaps too recently to show up on boards anytime soon, the use of gentamicin has been described with some success. So, just in case, we'll add a nice gentleman holding open the door for this young woman. How do I know he's a gentleman? Well, because he's dressed rather nicely and is quite chivalrous. Last but not least, it may be worth knowing that the calcium transporter that's defective in benign familial pemphigus is located in the Golgi apparatus. So, we've given our woman a gold G necklace and belt buckle. Talk about Gucci, huh? Alright, now before you rush off to Cool Tag to play laser tag, let's walk through Hey Hailey's one more time and review all these hooks. This sketch covers Hailey Hailey disease as shown by the store's name, Hey Hailey's. Another name for the disorder is benign familial pemphigus because it's an inherited blistering disease. Specifically, it's inherited in the autosomal dominant fashion as shown by the mannequin stand decorated in dominoes, and it involves the calcium transporter ATP2C1. Remember the comment on the sign if you like the mnemonic, I want to see Hailey's Comet one day. Or you can remember the 2-swan, C-shaped stand and 1 sword. The transporter is located in the Golgi, shown by the gold Gs that the woman is wearing. Clinically, patients have early vesicular lesions which progress to macerated plaques in the intertriginous regions. Remember the bubble wrap that's more of a plaque and the frills on the mannequin shirt around the axillae, lateral neck, intermammary fold, and groin. A feared complication is Kaposi's varicelliform eruption from secondary HSV infection, and this is shown with the Hermes headband on the second mannequin. In the back, we've shown the key histologic features, namely full-thickness acantholysis resembling a dilapidated brick wall but sparing follicles, psoriasiform acanthosis, and relative lack of disc keratosis. These are shown by the literal dilapidated brick wall from top to bottom, the psoriasis palm tree, and the big bald mannequin head. The best treatment is CO2 laser ablation, shown with the cool laser tag poster, but in the future, gentamicin may be something that's testable, shown by the gentleman holding the door open. Well, that's it for now. Thank you for your support, and please subscribe to our channel and share our videos on YouTube.